Good afternoon, everyone. Welcome to our panel discussion today. In teenage pregnancy loss and its associated trauma. My name is John Paul Isanya, a team leader in this Community Initiative, and I'm excited to be your host today. And I think without further ado, let me take the first minutes of this discussion as our panelists to introduce themselves, your name and a little background about who you are. I think it would be nice, ladies first, to begin with you, Shakira.
Thank you, Edi. My name is Natural Shakira Akomu. I'm a district manager, a community leader, a young and emerging evaluator, and a director in my organization, Social Enterprise.
Thank you. It's nice being with you on this panel discussion this afternoon. And to our second panelist,
Thank you, Mr. Paul. Um, Dr. Martin Taka. I'm a pharmacist by profession, and I work in Nakaseke Hospital, it's a district hospital, Nakaseke district. I'm also a pharmacologist, and my area of interest is particularly systems pharmacology. It's so much to drug development, and uh, a bit intriguing because I do so much drug use in pregnancy. So, in fact, when I was contacted, I thought it's going to be about that, and I was preparing myself for that. But I'm happy to be here, and I'm happy to contribute to the discussion. Thank you so much.
thank you so much, both of you. And I know that our viewers are very excited to listening to the wonderful discussions that the both of you are going to make. But before we dive into the discussion, it's important for us to build a little bit on the context. We know that teenage pregnancy loss can have far-reaching impacts on individuals and communities, often leading to significant emotional and physical trauma. Today, we are basically here to explore those impacts and discuss strategies for support and intervention. And I believe that we have all had an experience or interacted with someone that is young person, and they have had maybe an unplanned pregnancy, unintended pregnancy, and probably sometimes even had complications. And you know the difficulty they've gone through to manage the process, and sometimes the trauma that is associated with it coming from the communities, and sometimes even the families where we come from. And I think to kickstart the discussion, to have a smooth run in, we begin with you, panelist Martin. Could you provide insights into the physical and emotional health complications of teenage pregnancy loss?
Maybe if I were to lay the foundation, the problem of teenage pregnancy loss stems from teenage pregnancy. And you find that whereas the conversation about teenage pregnancy is not unfamiliar, the conversation about teenage pregnancy loss is completely unfamiliar. We do not usually talk about teenage pregnancy loss and its complications and far-reaching consequences. Whereas you can uh, find out from the Ministry of Health, for example, in Uganda, I will give you the key facts. Um, we are a country of 50 million people, and near half of the 50 million, um, that's around 44% uh, below 15 years of age. So now, the people we are talking about are the majority in the country. And then we are not talking about such a problem very often. You understand? And yet, it has far-reaching consequences that transcend even these people's lives. Imagine you are a teenager and you're trying to get yourself into the problems of adolescence, and then now you're getting pregnant, and now you had a loss of the pregnancy. That scenario is traumatizing. You understand? It's traumatizing both physically and emotionally. Physically, there are medical issues that will definitely appear. You understand? Um, I have gotten some content about Uganda demographic health survey, and this survey done every 5 years by the Ministry of Health, and they have discovered that um, loss of pregnancy mm, contributes more to IUMFR. I don't know if you know what that means.
It will be good for our viewers to really appreciate what it extensively means.
It's institutional maternal health relates. This is number of deaths maybe by institution. So adolescent women are lost more. You understand? They contribute more to maternal loss. So that's the foremost place, death. You understand? Death, and that's costing the country. Young people dying. Where are you going as a country if young people dying? It's not a good outcome. And then there are other health complications. You see, teenage pregnancies and pregnancy loss may come as intended more, but sometimes unintended. You understand? With the social pressures that are coming in from all sides of this girl. So, usually the health seeking behavior of in this scenario is not sane. You understand? And then uh, the the person ends up getting complications because they did not seek the right health services. So
Actually, when you talk of complications, what are some of the likely physical, medically recognized complications that teenagers may face, one, when they become pregnant, and then also the complications that normally arise in a case when there is a scenario of prenatal loss, be it intended or unintended?
uh, just like where I came from, um, the health seeking behavior is where it starts from. Where is the person going when they're pregnant? And who's going to help them?
Yeah,
Who is willing to help them?
teenagers especially.
You understand? So, mostly, if they are seeking to procure uh, an abortion or a loss of pregnancy, they will not do it the right way. So, mostly, most of these cases of avoided abortions, for example, have been teenage.
I know I'm interjecting you here, but when you mention things that are interesting, I want to follow up with a question.
Sure.
From your experience as a health worker,
Sure.
and in this context, I'm looking at a health worker in the field of pharmacy. We know that WHO is pushing for self-managed or healthcare, and in many of the illnesses that we have. What is your experience around teenagers seeking medications that might lead to pregnancy loss? And um, what are the results that you've witnessed as a person, I think, for lack of a better word?
Yes. Mostly, these teenagers, first and foremost, when, for example, they get pregnant, they may not know that they're pregnant. That's right. For anything, they will think that they are sick because pregnancy comes with physiological changes in your body, and you'll be sick, you'll feel sick. So they will procure medication that, for example, may be detrimental to the fetus. For example, the commonest, I would say, When the teenager, for example, engages in sexual activity, in such a sexual activity, unprotected, the other results that is most definitely not happening is sexually transmitted diseases. So they'll come to the hospital or a pharmacy to seek medications because they got an infection. And since they are teenager, you will hardly think that the person may be pregnant. You understand? And you prescribe a cocktail of medication, including maybe those that are therapeutic, maybe those that can lead to spontaneous abortions like fluconazole. You understand? So in that, the pregnancy may actually not continue, and the person does not know. You understand? It may be expelled. That could be good, but mostly not. So you get complications like incomplete abortions, where the fetus and the pregnancy contents are not totally expelled from the womb of the mother. So it brings in other medical interventions that may be even invested, like DRC. You understand? Dilated. You understand? So this impacts the, probably they were engaging in this activity for the very first time. You understand? So infections are one of the other problems. You understand? Because sexual transmission, HIV and other infections.
So, Dr. Martin, with us to one common before I switch to have insights from our second panelist. So for me, from you, I really want now to understand what are some of the common misconceptions or stigmas surrounding teenage pregnancy loss, and how can health workers or professionals address them?
Um, Mostly, uh, it's the community. Understand? And we are transcending from a community where it was illegal, a society where it was illegal to be criminalized in your teenagers or in your premarital time. Understand? So uh, everything comes with that. Understand? They will tell you will not conceive again if you have lost the pregnancy. They don't know how you lost the pregnancy, but they'll tell you will not conceive again. You understand? So, and yet, whereas it may be true, it's neither necessary nor a sufficient factor for you not to have another conception. Yes, you understand? And then some people say you have reached, you lost the pregnancy, especially if the pregnancy was intended. Uh, in our area there, in the world, uh, the Western tribes, understand? I mean, the usually, the girls get married in their teenage years. So imagine this young girl, even 15, 14, is getting married, they are having a pregnancy, and they lose a pregnancy. Mostly, those guys ask their direct parent.
So, yeah, just to conclude that line of discussion, how can health workers help to address these challenges, the stigma,
Yeah,
the misconceptions? What would be their role?
basically, it's about information and the right information, understand, to both the affected and the community, understand, for them to know that this is not the end of the day, this is not where it ends. These people can dig out, these people can be reintegrated into society, into schools, even if they have lost their pregnancy, even if uh, the social stigma comes with the ordinary. Imagine a child is in school, they get pregnant, they drop out of school, and then mostly they will not go back to school, depending on where they are. The statistics are there, understand? So it's about providing information to these people, guidance and counseling that is unbiased, that's non-judgmental, that is across the board, understand? To give them hope and to give them what next. Because people do not have a sense of direction, they will not know what to do next if they have lost a pregnancy. They don't even know what other interventions can be made, what contraceptive methods they can use. You understand?
Yes.
Because there's positive information. Previously, when we were still young, I can remember, the Ministry of Health was doing that. It has fallen apart of late with programs like PSA. PSA was everywhere. Primary schools, sexual education, sexual reproductive health education was across the board. We grew up knowing it straight talk. You understand? It is falling back recently. So it's a systematic problem that can be addressed from above until the lower levels as workers. But I want to comment that when you go to these hospitals and one, like that's what I was talking about. It is information that most people, women that seek like ANS services are actually doing 19. A very big percentage of them. Understand? And when you attend those ANS to
And some health workers don't even know how to deal with this.
yes. But when they are told, they listen and they know what to do. But these are people who are being completely naive about what next.
Thank you so much, Dr. Martin, for those wonderful insights. And I think from this discussion, we really had a lot about the trauma, it's emotional, physical, but you also pointed towards the prevention and the causes, and it's a whole spectrum of what can happen. Now, over to you, Honorable Shakira. From a governmental perspective, what initiatives or policies are in place to address teenage pregnancy and pregnancy loss? I know it's a broad question, but I know you can handle that.
Yeah, first of all, government has a whole office called probation office, the probation office, which has probation officers. So now those officers are working so hard that all young people who get pregnant and young girls who get pregnant are taken care of. Government is working strongly with the non-government organizations because for a case of Wakiso, really we do not have enough budget to take care of such children, so or teenage girls. So they end up taking them to homes and some other. So, but before even that, of course, there are processes that are being taken, including court. Yeah, court has to be aware that ABCD child, this is what is happening. So, government is using that office to ensure that all challenges regarding teenage pregnancy, the healthcare centers are aware of such cases in the community. So they ensure they take case by case to make sure that those children will not lose their kids. But in case they lose their kids, definitely, right now we've not seen a report on how many kids have died due to teenage pregnancy.
Yeah, of course, the information gets lost in Google and the tracking for maternal mortality and morbidity.
Yes.
And we know that some of the information is not really captured in HMI schools. But it's still important to appreciate what government is doing.
Yes. So ideally, that's what government is doing. Government is ensuring that there is a facilitated office to handle such cases. Even though it's pregnancy laws, they will ensure that steps are taken to maybe take care of maybe counseling the girl who has gotten pregnant and lost the baby. So it is that majorly the job of the probation officer to make sure that this girl doesn't go through trauma, maybe counseling is taking place, And due to the number of such cases, you find that also those officers are overwhelmed. So they end up pushing. Because they're the ones who register these non-governmental organizations, so they know where to take these kids for more counseling. So the entire policy is around that office, which involves the court and local government.
That sounds amazing. So we know that in dealing with challenges related to teenage pregnancies, in the discussion you've given us insights on what government is doing to support the teenagers. But we know that sometimes the trauma crosses to the parents and sometimes even the health workers, because they don't know how to deal with this. So does government have a plan, or have you seen things that may not be in policy, but maybe in practice are happening to not only support the teenagers who are in a position where they need support, but also to support the parents or caregivers who are confused and they don't know what to do because their 15-year-old or 12-year-old finds themselves pregnant and they just don't know how to deal with it?
Yeah, we've seen. We have a gender committee and what is the district local government. So we realize that most parents actually hide their children. When a child gets pregnant, they hide the child because they don't want to be embarrassed. Probably they are so religious, and also the children also tend to go away from home. Probably go to relatives who can understand them. So with all those challenges, I see health workers, especially midwives, working so hand in hand with the parent to see how this child can be kept, to make sure that they don't lose the pregnancy. But normally these cases do not even go far. In case that the child loses a pregnancy, the parents are kind of relieved. So, but there are so many challenges that come with that. Sometimes those kids die, and you don't even hear about it anywhere. You ask what happened to the kid, and they'll tell you other diseases. So ideally, information is hidden. So parents are not aware of what to do next. And also health workers try to help, but they cannot help you if you don't give full information. And then also government, in case of the probation officer, if for example the parent or the child, the teenage girl does not go to their office, they are not going to go looking for that child. So you find that most of them hide until they get complications, and then they rush to the hospital, even not knowing exactly what is happening.
That's right, please.
Wow. Yeah. So it's so amazing when we learn of these experiences that you share from the community. And for me, it shows the actual touch that you have with the community that you're leading. I know that you also have a strong inclination for monitoring and evaluation. So how do M&E efforts help us in understanding the prevalence and the perpetuating pregnancy rates?
Now, M&E for government. So what government is doing right now is to ensure that all government agencies, ministries, and departments are having a department of monitoring and evaluation. However, it's still a challenge in local government, yet it's local government that delivers the land implement exactly those activities that are supposed to take place. So you find that we do not have M&E officers to actually follow up on the effects and impacts on teenage pregnancies. So you will not get a pure evaluated report to ensure that maybe those now challenges are being worked on. So, so far, being the chairperson of finance, planning, and administration, or general duties, I'm trying to ensure that at least for Kiso district, where I represent people in the community, gets at least an M&E personnel, not the planner doing the job, because for them they will stop somewhere, but at least M&E goes further to ensure that these programs are actually evidence-based and so on. So government is trying at the upper level, you will find M&E officers, but at the lower level, it's not yet implemented.
Thank you so much. I think it's amazing learning the path that government is taking, and we're also happy that Wakiso district is taking extra strides ahead of many other local governments. We hope it is something that even other local governments other than Wakiso district will take on, so that we can learn from the information we gather to support the teenagers better. Before we move into the second round of our discussions and insights, I would invite us to take a break and then come back to do the second round.
Thank you.
Thank you.